Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Shannon Fox-Levine. She's president and a pediatrician at Palm Beach Pediatrics, and Kimberly Brennan, practice administrator at Palm Beach Pediatrics. Welcome.
Hi,
Thank you.
thank you for having us.
Yeah, excited for the discussion today. You guys have been doing some really interesting work with pediatric patients, which I love, and a challenging population, I think. But before we dive into the work that you're doing, the screeners and the outreach and engagement with them, maybe Dr. Fox, will you start us off? Tell us a little bit about yourself and Palm Beach Pediatrics.
Sure, yes. And again, thank you for having us today. This is the topic that we love to talk about the most, which is what we do every day to try to keep our patients and even our community children healthy and safe and help them grow up and be successful, healthy, safe adults one day. So I'm a pediatrician. I've been with Palm Beach Pediatrics for 21 years. And our practice has been on the map for 40 years. It was started by a pediatrician who had a special interest in mental health. So the comprehensive care idea is something that we've had, since the start of our practice, that integrating mental health with physical health, because really you can't, tweeze apart mind and body. It's all the same human body. So we have strong feelings about making sure that we're taking care of our patients, every need that they might have, and really being the hub for those spokes that maybe we need to reach out into the community for the extra help for whatever the patient's need may be. We
awesome.
have about 20,000 patients locally in Palm Beach Pediatrics, in our Palm Beach County. Palm Beach Pediatrics has 3 offices, and we have combination of doctors and nurse practitioners, including a psychiatric nurse practitioner and a psychologist to help us with the mental health component of what we see with our patients.
Wow, that's awesome. I love the comprehensive focus and the additional focus on mental health. I haven't heard that a lot of places, so that's pretty awesome. Kim, tell us a little bit about yourself.
Sure. I am the practice administrator here at Palm Beach Pediatrics. My background before joining this practice in 2020 has been in adult primary care, pediatrics, and most recently, before joining Palm Beach Pediatrics, I spent 5 years as the administrator for the medical department in a behavioral health nonprofit, which is what drew me to this practice. Seeing that was an adult, facility, and seeing what Dr. Fox and Palm Beach Pediatrics were doing to really shift the focus to preventive care instead of treatment for mental health, definitely drew me here. And one of kind of the joys of being an administrator is being able to support physicians and advanced practice providers, behavioral health clinicians, and getting to focus on the work they do day to day. And so that was what drew me here. And we also participate a lot in advocacy, both together, myself and Dr. Fox, as well as individually through the American Academy of Pediatrics and at the local and state levels as well. So we have a lot on our plate here, but pediatrics is a difficult population, but it's also a very joyful one.
Yeah, that's true. It is a nice one. Kids are amazing on both ends of the spectrum, I'd say. That's awesome. Well, Dr. Fox, September is Baby Safety Month. Talk to us about some of the ways Palm Beach Pediatrics is raising awareness for the importance of keeping these great infants and young children safe.
Well, I think probably about 10 years ago, I heard about something called toxic stress, and it was related to infant mental health screening, which, as a physician being trained now 25 years ago, I'd never heard of this before. And I thought, wow, does this make any sense? How does an infant have mental health? How is that even possible? So with that, learning about it 10 years ago and really paying attention to this and trying to be an advocate for this in the community, understanding that really even in the womb, there is that effect on the child's overall mental health, well-being, and even then lifelong physical health that can be related to that environment and the relationships that the baby has once they're born. And so we have recently, this year, started more comprehensive screening that is quite inclusive for every age group from birth until 6, with a particular screening tool that was developed by Tufts Medical Center, the Survey of Wellbeing for Young Children, or what we refer to as the SWIC. And it's a phenomenal way for us to advocate for the infant mental health and not, just children and adolescents, but starting at the very early age of picking up what might be some red flags and signs of where we can intervene early in the child's life, even right after birth, to make a difference in what their overall health will look like. And again, we believe that as pediatricians, we are preventative care, not just for the children and adolescents, but for adults as well. So what we can do with from birth to 21, we're setting up these, individuals for hopefully improved lifelong health outcomes.
Yeah, that's great that you're treating, the adults as well as the kids for these conditions. Kim, what else would you add? And talk to us, I know you're doing a number of early interventions and screeners, such as the EPDS screening for postpartum mothers and, also the adverse childhood experiences, the ACE screening. Talk about those and the role they play and the impact they're having.
Sure. I think one important thing to know about our practice and just how our philosophy in general, not just treating young infants, but children and our community as a whole, is that we very much believe in the preventive care model. We definitely feel that these early screenings can really catch and identify health concerns that, if they are not identified early in life, will eventually manifest and become really problematic for children, adolescents, and, as Dr. Fox said, into adulthood. So we very much consider ourselves a by-the-book practice with the American Academy of Pediatrics and the Bright Futures guidelines. And so we do follow those screenings. Since 2020, we were fortunately setting this up right before the pandemic to digitize these questionnaires. And that has allowed us to expand the amount of information we're gathering from patients prior to coming to our office, because people are a little bit more willing to fill out some questionnaires like the EPDS, the ACE screening, screening for trauma, not only in our patients, but also for the caregivers. We've been able to gather more information to provide better care, better outcomes. Since digitizing those forms, parents are much more willing to do them digitally than they are to fill out a stack of papers.
Yeah, for sure. I mean, as a parent of 5 kids, I understand. But
that's a lot of paperwork in a pediatric office.
Yeah, well, and then you change, and anyway, yeah, exactly. It's it's a challenge. But what's interesting is no one did ask us that, right? Across all the kids, I never had that. Sure, they did the weight, they did the growth, the classic ones, but we didn't experience that. So I love that you're doing that. Dr. Fox, what would you add about that? I know you also do the survey of well-being for young children. Talk about your work with these, which is more of an SDOH screening. Talk about that and the other screenings that Kim talked about.
Yeah, I mean, I think the screening tools are important, and they have really grown exponentially. Again, in the last 10 years. 10 years ago, we had very few of these that we were able to use. So there's been a lot of data to support them and effort then put into developing them to help us to use in a 15-minute appointment. So that's always our challenge as pediatricians, because we have so much to cram into a very short period of time. And we really need to have those high points, right? Like the things that really stand out as maybe needing an intervention that day, somehow flagged for us. And so the screening tools are the best way for us to do that. And having patients complete them before they come in is key for that workflow process. A lot of pediatricians struggle with this because they don't have the ability technology to support doing the screening tools prior, and then having technology to also help them again flag anything that is abnormal so that they can address it in those few minutes that they are spending with the family. So, and as I said, multitude of screening tools that we have implemented over the last 10 years. Pretty much every well visit that comes in the doors at this point has some type of screening tool to look for any, really any concerns, mental health concerns, food insecurity concerns, with the adolescents, any substance use concerns. Every well visit has a screening tool that we use to be able to flag something that needs to be addressed, but also sick visits. So 11-year-olds and over who come in for any type of, same day sick problem, they have a runny nose or a cough, are also being screened for any signs of depression, so that we would be able to intervene even at a sick visit. And that's important because, especially with the kids who are 11 and older, they come to the office once a year for their physicals. So, doing screening tools once a year, we may miss something that's going on with that child who's coming in with chronic headaches, that maybe it's not, a virus that they have, or, something that could explain it other than the stress that they're feeling at school. And these screening tools during a sick visit may be more useful than just having them fill them out once a year.
Yeah. That's great. Well, you both mentioned the use of technology, digitizing these screeners. Kim, talk to us. I know you've been working with Yosi Health for a bunch of this. How are you leveraging that technology to do these screenings?
Yosi Health has helped us tremendously in, like I said, expanding the amount of data we're able to collect from patients. And as Dr. Fox mentioned, in improving the workflows, Yosi has allowed us to not only collect the data, but actually will score the screening questionnaires for us. And, it is bidirectionally interfaced with our EHR, Athena Health. And so having that information, we're saving thousands of hours a year of staff and provider time in scoring and interpreting these screenings by having the information ahead of time for the appointment. As Dr. Fox was saying, a lot of practices haven't invested in the technology to allow them to do this. And my kind of argument for this type of technology is always those thousands of hours saved. If a clinician is not spending time scoring screening questionnaires, then they can spend more time face-to-face with our patients. And that is another part of what Yosi has allowed us to do, is, really let our physicians, the pediatricians, the mental health providers, the nurse practitioners, the limited time that they have, they can focus that time on face-to-face patient relationship building and, exam and assessment, really establishing what we consider to be the true primary care model. Pediatricians become a part of a family. Yeah. And Yosi has allowed us to do that because our staff and providers don't have to spend their time doing the administrative work of these screenings.
That's interesting. And I imagine you're using Yosi Health to outreach before they even come so they can fill out the screeners at home. Is that how you're approaching it?
They do. Yosi Health has done a number of things to help our practice. One is just the general patient intake form, collecting demographic and insurance information. They've helped us even in collecting payments before the data service. So they do some of our copayment collection, deductible amounts. They also have provided us with two-way SMS text messaging, which has become increasingly important since 2020. Parents, a lot of times we find that people don't answer the phone, whether they just don't want to or they don't have time to because they're wrangling a number of kids at the moment that we call. So
Yeah.
that has allowed us to kind of expand the access and communication with our families in a way that suits them best, without having to answer a phone call or return a call and play a game of phone tag. They also do our post-visit survey collection, where they help us gather the information from families on how they feel like their experience was and offer suggestions on how they feel like we can improve service. And that's been really useful for us. It's given us insight into everything from the aesthetic, decoration of our offices to wait times, to temperature, to everything and they are always pretty forthcoming with their compliments, as well as sometimes their suggestions. And Yosi has helped us gather that data in a way that we can centralize it. It's collated. We can download it very easily and view a large amount of data at one time on the post-visit satisfaction.
Well, that's nice, because
Yeah.
how often do you get the attaboys, from the patients? Usually you just hear the complaints. So
Yeah,
that
and sharing them with our teams has been key for them too. Like these are people that love, working with kids and having those positive comments, in a really tough day where you're giving a lot of shots and, upsetting a lot of children, having a nice positive comment can definitely help.
That's beautiful. Dr. Fox, I mean, from what Kim said, a couple of things that for me seem to stand out from the physician perspective. I'd love to hear your thoughts as far as one, having the data at the point of care, not just in some paper that you have to sort through and then it's not in the place you thought, or it's scanned in and you got to pull it up or whatever it might be, right? The previous workflow, but also the ability to text the patient, or the patient's caregiver. Like, talk about those and how that technology has helped you, create a better experience for the parents and the children.
Well, one of the ways that I think this helps, especially with the texting, is that when they do come into the office and they haven't completed the online check-in process, the front desk staff are able to push it right to them again so that they can complete it in the office. And it really is best for us if they complete as much as they can through their, Yosi check-in system, because that's all integrated into our electronic medical record. So we see that it flags it for us, so we can spend the best time just really addressing those issues that need to be addressed in the office at the that time of the visit. So that's really a key way, I think, that using technology is, and that I think that's the future, trying to get them to do as much as they can on their end that is electronic, so we don't have paper. The paper much more easily gets lost in the shuffle. It's, harder to access, to look at. You can't really look at the data as well because, we do it, but it's not ideal in tracking the scores over time of each one of these screening tools. We're able to do that in Athena. We can track the actual score to see what the trend is. But if it's on paper, then it takes somebody going in, putting in the scores, making sure that happens at each visit. Where if it comes through Yosi into Athena, it goes right into that, the data plot, and we can see it as we walk into the room. We can see what their screening tool scores were for the last few years, even, to know what the trend has been.
Yeah. Well, and as a patient, I don't want to fill it out on paper either, right? I don't want to see my handwriting. You can't read that.
Right.
I think too, one thing to add to that is that, when you see reviews, not just online in general in the healthcare space, and I think every healthcare organization and provider has this as a challenge, right? The online reviews, the Google, the Yelp, WebMD, whatever it is. And I think that this allows the providers to have a very quick refresher of who they're seeing, right? They have that data readily available, and it gives them a clearer picture of what's going on currently with that child without having to do an extensive time suck review of going through multiple notes from previous visits. A lot of times what is indicated in these screenings, parents have the ability to include some additional notes. And that really also helps save time in the visit, because the provider can just say, I see here that you noted, instead of having the family, repeat all of that same information, which is just, even if they don't realize it in the moment, is taxing on patients and, lowers the satisfaction.
Oh, I think we realize it too, but
Yeah.
it's painful, right? You're like, I already
Yes.
told you, I told her on the phone.
Uh-huh.
Like,
I already answered all these questions.
twice, yeah. Yeah, so that's great. Kim, what do you think's next for Palm Beach Pediatrics? Are there other things you're looking at to, provide that best ongoing care for the babies and young children?
There's a lot that I think we both think and hope is coming next, right? I mean, what we hope when we talk about kind of our view on preventive care is that we see that become the norm. There's currently kind of a charge around pediatrics. There's a light finally being shined on pediatrics being an underfunded specialty. And we're seeing that play out in, even longer term scenarios of the lack of pediatric resident matching that happened in the most recent match cycle. And we want doctors to enjoy pediatrics. Most pediatricians don't choose it for the money, but at the same time, they definitely deserve to have a comfortable life when they have dedicated their life to taking care of their community's kids. So that's definitely next. And for us, for a long time, value-based care has been a part of our practice. But in pediatrics in general, it's been a slow churn, right? A lot of practices just don't feel they have the resources. And so I do think that's what's next for pediatrics. It's been what's been for adult care for a very long time. But I think it's also time for pediatricians to realize that quality and value focused care isn't as negative as sometimes it's viewed, right? Because in those scenarios, when those programs perform well, everyone wins. The family wins, the patient wins, the providers win, and so do even the payers, and so I think seeing technology and agencies, and Yosi is doing this currently, we know, kind of shifting the focus to pediatrics, and realizing that investing in pediatrics isn't just the right thing to do, which I think we would all agree, like taking good care of child health is the right thing to do, but it's also a good business case, right? Because it's going to help us prevent, lifelong health disparities. It's going to help us prevent lifelong chronic issues that these patients may experience if they're not identified. And I think one day the payers will notice that too, that eventually, if they don't, invest in the pediatric care for these kids, they're going to be responsible for paying for them as adults. And that's where that's more of the hope side. But I do think we're starting to get there in pediatrics.
Yeah, I mean, to be frank, you're kind of exposing my bias. I wouldn't have thought about value-based care for pediatrics, right?
Yeah.
Well, they're kids; they're generally healthy, but you're right. I mean, when you look at it from this comprehensive viewpoint, there is a lot of things that can be done to prevent future problems.
And we know if they're immunized kids that receive, high quality preventive care services, they have better outcomes, not only in childhood, but across the lifespan.
Great point. Dr. Fox, anything you'd add as far as where you're headed and things that you're excited about?
And not only, for things like immunizations, but also screening for trauma in childhood. We know that there is a very strong relationship with those who experience trauma is children and adults who have not just mental health disorders, but also autoimmune disorders like multiple sclerosis, cancer. So again, we are really, as we say, the boots on the ground. We're the ones here that are really trying to do that preventative work to keep adults healthy down the line. So, I think our role in our community, but also really nationally, and as I echo everything Kim said, we both work at that advocacy level, locally, statewide, and nationally to really make sure that not just payers, but also other doctors understand the importance of the screening tools and locally, really trying to educate our fellow pediatrician, family practice medicine doctors on how to screen for these mental health conditions when children are young, or the trauma when they're young, because over time it is going to actually help us have a healthier generation in 40, 50 years from now. So that's, really our goal here is that preventative medicine, looking way ahead and starting now to build a healthier country, long term.
Yeah, absolutely. Well, Dr. Fox, Kim, I appreciate you taking time talking with us. I love when I do an interview and I get educated in a lot of different ways. And I feel like you both did that for me today and for educating our healthcare IT Today community. So appreciate you taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks a lot.
Thank you.
Thank you.